Good morning, students. Before I start the topic of anemia, I would like to discuss some basics. These basics are: what is a bone marrow, processes like hematopoiesis and erythropoiesis. Now, let us start with bone marrow and hematopoiesis. What is a bone marrow? These particular slides will be given to you, so need not worry. There are few points that I will be adding. Kindly add those points to your notes. Now, what is a bone marrow? A bone marrow is made up of a compact bone, spongy bone, and a bone marrow. So, what does this particular line mean? So, this particular, if you can see the structure, if you see the structure very nicely, you will come to know that this particular bony part is a compact bone, but within those you have a softer area in the center, which is known as a red marrow. So, bone marrow, so you need to know what a bone. So, this is a bone. In this bone, you have the outer portion, which is a compact bone. That is, see, when you break a bone, you have a very hard outer surface. That is known as the compact bone. Inside the bone, when you cut the bone in half, you will see that here you have something called the red area. This red area means it is rich in blood supply. So you have arteries and vessels. And in the center, you have the yellow marrow. This is the red marrow. Red marrow, as the name suggests, is red. Yellow marrow, as the name suggests, is made of fat. So, bone marrow. Bone is made up of a compact bone, that is the outer surface. In the inside, you have the red spongy area and the yellow area. Now, the bone marrow will now form stem cells, red blood cells, white blood cells, and platelets. Moving on, we need to understand why hematopoiesis is important. Hematopoiesis is a process that takes place in the bone marrow. So, in the bone marrow, you have a process called hematopoiesis. This hematopoiesis will cause the formation of blood cellular components. What are these blood cellular components? These are your red cells, white cells, and platelets. We need to know what are the functions of these cells. Why are we studying these cells? Because of these particular functions that help us stay alive and healthy. So, the red cells functions are oxygen transport. This is the most important function of red cell, that they transport oxygen. Lifespan is 90 to 120 days, mostly 120 days, plus or minus 30 days in cases in some anemias that their blood cells can die off very quicker than they rest. White cells. These white cells help as body defense against infection and tissue injury. White blood cells, that is WBCs, are neutrophils, basophils, and eosinophils. Among that, neutrophil has a lifespan of 8 to 12 hours. Platelets. Platelet helps in maintaining the integrity of blood vessels and prevent blood loss. Their lifespan is 8 to 10 days. Why platelets are important? For example, in dengue, when your platelet falls very low, you have lot of bleeding within the body. That is why platelets are important, so you don't bleed inside, there is no internal hemorrhage. That's why platelets are important to maintain integrity of blood vessels and prevent blood loss. Now, coming to sites of hematopoiesis. This is a very important table that you'll have to remember. This image is given in your book, Harsh Mohan. Now, the sites of hematopoiesis that is given in this skeleton, these are for adults. Okay. Now, coming to here. You might be saying, what is this up to 3 months, 1 month, 3 months, or 4 months? These take place in your intrauterine life, that is, as a fetus in the mother's womb. So here, up to 3 months, the site of hematopoiesis is yolk sac. 1 to 3 months is liver, 3 to 7 months is spleen, 4 months is bone marrow. Now you will be thinking 3 to 4 months is spleen, that why is 4 months coming in between? We will see a particular graph that will explain much further. After birth, bone marrow, spleen and liver. Birth to childhood. This childhood means less than 20 years. Okay? Birth to childhood is bone marrow. Now what happens when you are growing? When you are growing, if you see this bone marrow, initially when you are a baby, there is less yellow bone marrow, that is less fat. But when you become a child, especially in your pubertal age group, here the yellow bone marrow increases. That is why what happens lot when you are a baby. When you are a baby, all the bones will have bone marrow activity. But once you become a child, not all bones, only specific bones, some amount of bones will have bone marrow activity. And when you become an adult, that is more than 20 years, you have the bone marrow of the skull, of the ribs, of the sternum, of the vertebral column, the pelvis, and the proximal ends, that is the ends, proximal means the ends of femur, tibia and humerus. Some say that the sacrum also have hematopoietic functions, which to some extent is true, but is very minimal. Now, as I said, that we will be looking at a graph of haematopoiesis to understand much clearer. Now, coming to this chart, what this chart means. See, as I had already mentioned, up to 3 months, that is from the baby is born up to 3 months is the yolk sac, that is till 3 months. From here to 3 months is the yolk sac. After that, from 1 month, liver starts becoming the hematopoietic site. At 3 months, it becomes the spleen. And at 4 months, you can see at 4 months, the bone marrow will take up the function. So it's a very important point. From 0 to 3 months, it's the yolk sac. At 1 month, it's the liver. At 3 months is spleen. At 4 months is the bone marrow. Now, this is in the fetus. When the baby is born, then the bone marrow takes up all the entire function. During this time, all bones with red bone marrow will act as hematopoiesis. After that, till under childhood, during this particular phase, it's still the bone marrow. In this bone marrow, you need to understand that bone marrow is going under changes because we are growing. Because we are growing, fat is getting deposited in the bones. Then, in the adult life, you can see that all different bones will help in hematopoiesis, like the vertebra, the pelvis, the sternum, the ribs, femur, and to some extent lymph nodes. These happen only in cases of infections. Okay, so I've explained these things in a graph over here. Now, coming to the initial step of hematopoiesis is the hematopoietic stem cell. Hematopoiesis cannot start without a hematopoietic stem cell. These hematopoietic stem cells, in hematopoiesis what happens? you have mitotic division and differentiation. Because of these mitotic division and differentiation, hematopoietic cells will give rise to two progenitors. What are these two progenitors? The two progenitors are myeloid progenitor and lymphoid progenitor. I am writing short form here so I can finish the class soon, but kindly never use short forms in exams. Okay, so we need to understand why hematopoietic stem cells are important and what are its functions. These hematopoietic cells are self-renewable, means these will keep forming again and again and again. And the next important function is it helps in differentiating progenitors like myeloid and lymphoid. These myeloid and lymphoid progenitors will indeed lead to red blood cell formation. This is platelet formation, and all the rest will form WBCs. Okay, so this is an important step. The initial step of hematopoiesis is hematopoietic stem cell. Now, we will be looking at a very important diagram. This particular chart is given in Harsh Mohan, which I will break down and try and explain in a different image so you can understand much better. Okay? Now, hematopoiesis, these are all this particular step. All this is taking place in the bone marrow. Okay? All this is taking place in the bone marrow. Now, we are starting with hematopoietic stem cell. Now, we need to understand there are some factors which will cause the differentiation of these two cells. What are those factors? These factors are your erythropoietin, granulocyte colony stimulating factor, granulocyte macrophage colony stimulating factor, and thrombopoietin. So we know that there are some factors which will regulate the functions of hematopoietic stem cell. Now, hematopoietic stem cell will differentiate as a lymphoid progenitor and a myeloid progenitor. Now, lymphoid progenitor will give rise to lymphoblast. And they can also directly give rise to dendritic cell. Now what happens? These cells that are formed in the bone marrow will now enter the blood vessels. When they enter the blood vessels, lymphoblasts will become B lymphocyte, T lymphocyte, and natural killer cells. And lymphoid progenitor can directly form dendritic cell in the blood vessels. These will go into the tissues when there is an injury or infection. So these are also known as the tissue dendritic cells. Now we have finished the lymphoid. We finished the lymphoid section. Lymphoid progenitor is over. Now we are going to the myeloid section. In myeloid section, there are three divisions. These three divisions are: number one, first we are going to myeloblast. What happens in myeloblast? Myeloblast will give rise to band, means immature neutrophils, band basophils and band eosinophils. Now, these band neutrophils, basophil, eosinophil, when they come inside the blood vessels, they will become mature neutrophils, mature basophils, and mature eosinophils. These will also be secreted in the tissues when there is need, in case there is a tissue injury. Now, we have finished one of the divisions of the myeloid progenitor. This can also be differentiated into pre-monocyte. Pre-monocyte will become monocyte in the blood vessel, and this will also become tissue monocyte or macrophages Another is your precursor mast cell. Precursor mast cell. What are mast cell? Mast cell is a very important factor. If you have come across asthma, in asthma, whenever there is an inflammation of the lung margin, in that mast cells get activated. So the pumps that we use, pumps usually have mast cell stabilizers. So it will reduce the inflammation, hence it will help the asthmatic patients. So this precursor mast cells in blood vessels will become mast cells, which will also go into the tissue and become mast cells. Now, what happens to the last portion of the myeloid progenitor? These are your megakaryocytes. Megakaryocytes now will break and fall into the blood vessels. These are your platelets. The last point is your erythrocytes. These erythrocytes are immature inside the bone marrow, but when they enter the blood vessels, they become mature red blood cells. Okay, so in a very simple way, I've tried to explain the haematopoiesis. Now, coming to the thing that I've shared, here you can see the hematopoietic stem cell will cause lymphoid progenitors and myeloid progenitors and lymphoid progenitors. The lymphoid progenitors will form lymphoblast. See, what I've taught you is also correct, and this image is also correct. So please do not get confused. That is much easier than this. So you can see these are your hematopoietic stem cell. This will differentiate into myeloid progenitor cell and lymphoid progenitor cell. Lymphoid progenitor cell will give rise to lymphocyte, will give rise to lymphoblast. First you get lymphoblast. These lymphoblasts will then differentiate into B lymphocyte, T lymphocytes and natural killer cell. So you can see B lymphocyte, T lymphocytes and natural killer cells. What is bone marrow? Bone marrow means B and natural killer cells are found in the bone marrow, while the T lymphocytes is found in the thymus, hence the name TT for thymus. Then you see over here myeloid progenitor cell. Myeloid progenitor cell will lead to formation of a granulocyte monocyte progenitor. This will give rise to neutrophils, basophils, eosinophils and monocytes, and we'll see these are the WBCs. These erythrocytes will form red cells and megakaryocytes will form platelets. So you can see the parallels between these. Now, as I told you, there are some particular factors that cause hematopoiesis. Now, if you see over here, you can see 1 factor, 2 factor, 3 factor. Okay, So in this particular series, you can understand there are three important factors, but there are actually four. So what are the factors responsible for hematopoietic stem cells? Are erythropoietin for red blood cells, granulocyte colony stimulating factor for granulocytes, granulocyte macrophage colony stimulating factor for granulocytes and macrophages, and thrombopoietin for production of platelets. You can see over here the factors are, you have erythropoietin, you have germs, you have granulocyte colony stimulating factor, and granulocyte macrophage colony stimulating factor, and thrombopoietin. So these will help. So if in case if I have to add these factors in this particular thing that we had drawn, so you need to understand. See, you are seeing all the white blood cells over here, right? So what is the factor that will come over here? Just common sense. You have your granulocyte colony stimulating factor, granulocyte monocyte colony stimulating factor. For erythrocyte, now see, for erythrocyte you need erythropoietin. So erythropoietin will come here, and for platelets you will have thrombopoietin. So you understand that these particular cells, that these factors will come here as well as in this particular place. So 1, 2, 3, 4. 4 of the factors that is required for hematopoiesis has also been explained in this diagram. Okay, so I want you to do this diagram whenever they ask in the exam, because this is the basic, and these are the terms that we will be using in the future subjects. Okay, so we have finished up till here. I have also given a very simple diagram which you can use if in case you find my illustration or the chart given in Harsh Mohan is very difficult. This is a very simple thing, but here you will have to mention the factors responsible. So you have erythropoietin, you have thrombopoietin, and for this you have in between, you just put like this. So you have the colony stimulating factors also. Okay, now coming to bone marrow examination. Now you have understood what is bone marrow, what is hematopoiesis. Now we have to come and understand that how do we know all this information. We know all this information because bone marrow examination. Now before we do bone marrow examination, we have to do peripheral blood smear examination. What does peripheral blood smear examination means? You take the blood, you put it on a slide and you swipe it. When you swipe it, you can see all the cells. So peripheral blood smear examination is first. After that you do bone marrow examination. Bone marrow examination is done by two methods, aspiration method or a tryphene biopsy method. So what happens is, I have inserted a video for better understanding, but before that I'll try to explain. Now you can see this is an aspiration needle and this is a biopsy needle. Now a very important but a very it's mostly common sense. Now you see over here the starting, the needle is very pointed. So what you can do, you can only take out some amount of blood. So blood is always aspirated. So this is method for aspiration. Here you see it's a wide bore needle. Why do you need something so big when you have to take out a small portion, of bone marrow? So this, when you take out a small portion, that is when you do biopsy. Okay, so we will be keeping these needles during a practical, so you understand what is a bone marrow aspiration needle and a tryphene needle or a biopsy needle. Okay, now we need to know the differentiation between aspiration and biopsy. See, I have marked whatever is very important in red. So the site for aspiration is sternum, posterior iliac crest, and the tibial head in infants. Only in infants we use the head of the tibia. In biopsy it is the posterior iliac crest. Now instruments. Instrument for aspiration. This needle is known as the Sala's bone aspiration needle. But in biopsy that needle is known as Jamshedi. Okay. Now stains. What are the stains? Now what happens if you see the video that I have linked, you will come to know that if this is a patient's back that we take out an aspiration or a biopsy, we have to take a slide and put a small amount of blood, and when we smear this blood, we will come to know the different types of cells that are present. So to do this process we need some stains, Romanovsky sky and Pearl's reaction. Romanovsky sky, this is for staining. Now these are some important points that I'm telling you, which will be taken in great detail in physiology and pathology. Now when we take a blood film, now I'll try to explain you much better. See, now if this is a human being and here is the iliac crest, we are putting a needle. Okay, this needle will take some amount of blood. This blood will put on a glass slide. Okay, when we put this in a glass slide, we have to spread it. So what we do, we spread it. After spreading it, we have to air dry it. Air dry, that means you just keep it outside, like in front of a fan you can keep it and it air dries. After that you have to fix the stain. This means you have to fix this. For fixing you need to know, for aspiration and biopsy they are different. For aspiration you use Romanovsky, and in biopsy you use eosin and hematoxylin. Okay, these are the stains you use for fixing. Now after this, if you have to see there is iron present, if you want to see there are iron present, you use Pearl's reaction. Okay, so when you take, this is the patient's back, this is the iliac crest. From the iliac crest you take, so this is the injection, you take some amount of blood, that blood is put on a slide, a smear is made, you air dry it, then you fix the stain. Once you fix the stain, for aspiration you use Romanovsky stain, for biopsy you use eosin hematoxylin. And then if you want to see iron, you use another reactor known as the Pearl's reaction. Okay, you will see the video and understand much better. Now you see the time taken for aspiration is 1 to 2 hours and for biopsy is 1 to 7 days. Biopsy takes a long time because you have to read a lot of cells. See, what is the importance between aspiration and biopsy? In aspiration what happens, you can see cells better. Okay, but in biopsy you can see the entire larger picture. Here you can see larger picture, here you can see a smaller picture. I will try and explain. In the last page that I have given, you can see I've asked you a question, which one is better. Now I will try to zoom in so you can understand. See, this is an image of a bone marrow aspiration and this is for bone marrow biopsy. What I said, the cell morphology is better in bone marrow because you can see individual cells very clearly. Okay, but if you want to see the entire bone just from outside, just to see from the outside whether it looks okay or not, if you want to see everything together, to see the morphology, like how the cellular architecture is, then the bone marrow biopsy is better. Okay, so here you can see Trypan biopsy is useful over aspiration since it provides an excellent view of the overall marrow architecture, cellularity, and presence or absence of infiltrates, but is less valuable than aspiration. See, most useful is biopsy, but it is less value. Why is it less value? Because when you can see the cells individually, so you can see the cells individually, you can come to know that there is something wrong inside the cell. So that is even more valuable. Okay. And why do we use this aspiration in biopsy? Aspirations are used to differentiate different types of anemia. If there is any leukemia, any neutropenia, thrombocytopenia, means whatever abnormalities are there in the elements. What are these elements? These elements are the products of haematopoiesis. Like if in case there is some injury or something that happens to the hematopoietic stem cell, because of that you'll have immature progenitors, you'll have immature Wbc, Rbc and platelets. So these are all causes of immaturity or abnormality. In biopsy helps in diagnosis of aplastic anemia and lot of different leukemias. Now I have just shown you a picture. See, a person is lying down. This is the pelvic crust or the iliac crest. Here you are putting the injection. This injection you see should cross the skin, the bone and should enter the bone marrow. Okay, so you have to put it straight. It has to go straight inside. So this is the video. I hope this will play for you. If not, let me know. I'll share it via WhatsApp. Now, what is the importance of bone marrow? You need to know the importance of bone marrow. Bone marrow will help you assess the type of cellularity. Means you can come to know what type of cells they are. It will help in diagnosis in the details of developing blood cells. Like you'll come to know whether these blood cells are normoblastic, means are they normal in size or are they big in size, megaloblastic. Are they myeloid or lymphoid? Are they macrophages or megakaryocytes? It will also help to know the ratio between erythroid and myeloid cells, means ratio between RBCs and different type of WBCs. Any kind of storage disease. See, if you have an iron deficiency syndrome or an iron overload syndrome, in that what happens, your cells will hold on to a lot of hemoglobin. This hemoglobin will be shown in bone marrow examination. Now in bone marrow examination you can see other things rather than the blood cells. You can see any signs of cancers, you can see any kind of infections, any parasites, like you can see malaria, you can see leishmaniasis and trypanosomiasis. In some conditions, bone marrow can also be used in cytogenetics as microbiological culture, biochemical analysis, immunology and cytological markers. So other than studying the blood picture, these are other things where you can use bone marrow examination. So I have finished bone marrow and haematopoiesis. Thank you so much. If you have any doubts and if you have not understood anything, kindly take a screenshot of what you have not understood. I will try to explain you in a different video. Thank you so much.